It's always been a great pleasure to work with John Baines and the team there, because I've led on a couple of tours for them. It's been fantastic. So what I'd like to talk about is my view of harmony in health. And it's a concept that I've developed over the last few years from my traveling abroad to India and China, and my work as a gynecologist and work with the Poundbury Clinic in Dorset in London. But it's really a sort of a potpourri of thoughts about how I can see harmony and health is so important for us, for our patients, and also in some way for the health service. But it's not new. And I'd like you just quickly to look at this slide and read it. And then I'm going to ask you, how many F's do you see here? And just count how many F's you see in this slide. Now, most people say 3. Occasionally I get 4. Rarely I get 5. And very, very rarely I get the true answer, which there are 6 F's. And why have I used that slide? One, to make you think about what we're talking about, but also I'm not saying anything new. A lot of what I'm talking about is going on, but we don't realize it. So let me move on. Why have I become interested in a harmonic approach to medicine? And harmony is us all working together. And it's really going back to my work as when I worked in the British Olympic Association as a doctor, and had the privilege to go to 3 Olympic Games, both Sydney, Atlanta, and then gynecologist to London Olympics. And I realized that in order to help a individual athlete win gold medal, we have to work in harmony. We have to work as a team in order to move on. And so in the sort of the 5 rings of the Olympics, what I found is it's looking at attention to detail, to developing teamwork, to helping plan the journey and setting goals, and also the belief and role of the mind as well as the body, and keeping it simple. And that's what we need to think about, is how we can help our patients, and how we can help our patients help themselves and work together in order to help them win their gold medal. But does medicine need to change? And part of harmony, which I go back to, is the role of history. And there's lots of evidence that medicine does need to change. And this is a book in the sort of 1960s, that there's great demand on the NHS. And now with COVID, there's going to be even more enormous demand on the health service. We're all living longer, not necessarily in good health. We may be living longer, or are we taking longer to die? And therefore we need help, guidance to help obtain and maintain good health. We look at the role of communities, and the COVID has really brought out the community spirit. But there are fewer community roles, and we've got to look at how communities can help the individuals. And we do know that in acute hospitals, care is getting more complex. But we need to look at is it necessarily getting better results? And are we providing everything for everybody? But also, I think we'll all agree that we're developing an unhealthy population in an unhealthy environment. We're getting obese, we've got chronic ill health, we've got self-inflicted ill health, and sadly, we're going to see a huge amount of mental illness, homelessness because of inequalities, poor education on healthy living, social divide, which is going to get even worse because of COVID, and then what we have all beginning to forget about by COVID, but it's a tsunami coming, climate warming and environmental pollution. So I think harmony is going to help solve that. And I've used the word harmony to look at what I think are the important areas, and I'm going to spend the rest of the talk just talking about these areas. H is for history and happiness. A is for an active mind and body, but also acceptance and also the role of architecture in our health. Then R is resilience and reflection and looking at all the options that are available. And we as health professionals have to give people the options. My father's upbringing, when he was bringing me up, he said, Michael, I never want you to come back and say, Daddy, why didn't you tell me so? So we've got to give all our patients all the options and then let them decide what's the most important thing. And medicine is beyond pills and procedures. It's membership of society. And we've got to burn out inequalities and we've got to create equal opportunities for all. And this will make a happy, healthy environment. We've got to therefore develop an outside the box approach, an integrated approach, look at the role of nature and give our patients all the options, and then they help them decide the way forward. So that's the sort of the 7 points of harmony. So let's just put back from history and happiness. Well, harmony is respecting the past, and we've got to learn from history. And two of my great heroes, I remember when I was a medical student, I was told, and I always tell all my medical students, what's the most important advice can we as doctors have self-reflection about? And what's the most important advice? And who would you like to be in history? And it's two people, Socrates and the Dalai Lama, because Socrates was executed because he knew that he did not know. And the Dalai Lama says that all the time. I don't know. There's so many questions, and we've got to be honest with ourselves that a lot of the answers we don't know. And then if we move on, William Mayo, who set up the Mayo Clinic, said the aim of medicine is to prevent disease and prolong life. And the ideal medicine is to eliminate the need for the physician. I don't know about the surgeon, but the physician. So if we can help people develop their own healing by using a harmonic approach, perhaps we can reduce the burden on the health service. And about the role of society, George Bernard Shaw, looking at the history, said, I'm of the opinion that my life belongs to the whole community. As long as I live in it, it is my privilege to do what I can and whatever I can. So we're learning from history and then going back to traditional, and that's where I've learned by touring with and being a tour leader with John Baines. We can learn from traditional Chinese medicine. We can learn from Indian medicine, from the role of yoga, Unani, Siddha, and homeopathy. Now, I know there's a lot of dispute about whether these are any good, but we need to learn some of the good points because they can be introduced into our practice. And I also think that all our life's a spiral, going back to the spiral I showed at the beginning of history. And in some way, the COVID has done that for me, that in the old days, doctors used to do home visits. Now the Zoom call is the virtual home visit, which you can learn a lot more about your patients by seeing their home than you can nowadays by just having the mask. And it's not face-to-face appointments, it's mask-to-mask. But happiness is also important. And if you haven't seen it, can I encourage people to look at the Action for Happiness website set up by Anthony Seldon and other doctors. And the role of happiness is so important. And he calls it, what can we do and how can we create happier living? And it's the great dream: giving, relating, exercising, appreciating, trying out, I keep learning new things, direction, setting goals, resilience, emotion, acceptance, and meaning, I being part of something bigger. So happiness is so important in our life. And people dispute whether that's the right term, but do look at the Action for Happiness, and they have some fantastic talks. But what we do also forget, and a harmonic approach to health, is that we can learn a lot from our animal world. And I do a lot of work with hormones, the effect of hormones on fertility. And I remember once going to a stud, very, very successful horse stud, in England, and where they had thoroughbred mares and stallions. And I said to the owner, I said, apart from good nutrition, what's the most important thing for your mares to get pregnant? And instantly, she said, they've got to be happy. And so even in the animal world, they realize the importance of happiness. And I can give you lots and lots of stories about how unhappy animals lead to unhappiness in health and bad general physical health. So moving on, we all know harmony, the H, the A now, the active mind, body and acceptance. And we know that a healthy body and a healthy mind leads to a happy life. And there's more and more evidence about the role of exercise, not only in cardiovascular system, but there's some good work coming out about the role of exercise and helping decrease cancer and helping even improve the outcome of cancer treatment. And it goes back to one of my earlier slides about need to keep it simple, that exercise doesn't have to be complicated. We can just walk, and the benefits, and anybody who hasn't read this book, Shane O'Mara's book on the praise of walking, professor in Trinity in Dublin, it's fantastic. And it shows how just by walking, and not only the exercise of walking, but in being in contact with nature, can have a huge impact, not only on your physical, but also your mental symptoms. And that's where harmony can help. And also, I think I put this lovely picture of my mother who sadly died just before COVID. Thank God she did die before COVID because she never coped with it. But she said, Michael, I've always got to accept and be content. And that's something which we don't do. We are all striving for possibly unachievable goals, and to become content and accept the situation can often lead to a healthier and happier life. And that's the harmony. And that's what Gandhi said, have a day of silence. And silence helps rest the fuddled mind. So I often say to patients, which is very easy to say, but very, very difficult to do, have 1 minute silence 3 times a day. Go out to your garden or just sit on a chair and be silent. And also with your partner, if you go for a walk, my wife and I do it, we can never actually do it for 5 minutes. We try and walk in silence for 5 minutes. After about 4 minutes, I'm normally giggling, or she's trying to tickle me and make me laugh. But what I'm saying is we all think about complicated things, and perhaps that's what COVID has taught me, is that the roles of simple things can be so good for the mind and the body, and in the long term, your health. And one new book that I think is also well worth reading is Do Pause, You're Not a To-Do List. And it talks again about the power of pausing, and how Bill Gates goes away for 2 weeks, I think every 2 years, and just does nothing. And often inspirational things happen when you're pausing. And we need to keep on remembering that. Then we just move on, because these are just, as I said, a potpourri of ideas, that the role of the environment and its biophilia, the role of the environment and how it can have an effect on our health, and its innate and genetically determined affinity of human beings with the natural world. And this goes back historically, the healing power of nature. And Robert Powell said, he argued that many illnesses could be cured without the aid of medicine, but by paying attention to. So listen, this is 1839, way before David Attenborough was here. But David Attenborough is such a powerful, energetic and inspirational man. But here it was talked about that paying attention to air quality, the food we eat, and how physical activity we do, and the rest we receive, along with our state of mind. So this isn't new, but we need to think about it. And we do know that in hospitals, that a hospital, if you're in a ward with a view and a nice view of nature, you have shorter stays, less medication, improvement in general well-being, and the role of natural life, and that's a light. And that's why good architects and the involvement of biophilia in developing our environment is not only nice architecturally, but it's good for our health. And this is how we're all interconnected. Now we move on about resilience and our reflection and review of all the options available. That resilience, that and we're seeing it more and more and more. And there's a most wonderful book by Lord Moran, who was the doctor to Winston Churchill, and he wrote about his time in the First and Second World War. And I do apologize that he's talking about men, because at that stage there were only men in the army. But he said men wear out like clothes, that we forget, and we forget the need for rest, going back to Gandhi. Courage and willpower of limited stock. And we're going to see that so much in the front line of the NHS. And also, we've got to allow grief, and we've got to celebrate the things that have not changed and make them key components of mainly normality. And I think this is the most important thing, definitely during the COVID time, that we've all changed. And a lot, it's been awful, awful, awful for certain people, awful deaths and awful losing jobs. But there has been some positive things. And I think in the rush to return back to normal, consider which parts are worth rushing back to. And I think one's all got to think about that. And also, when we talk about evidence, when we talk about what are the options, we talk about evidence-based medicine, but evidence-based medicine is actually made up of three things. It's what the scientific evidence is, what your clinical judgment is, and what is your skill, and what's the patient's values and preferences. And we forget that. So we've got to give our patients choices. We've got to talk them through the choices, and they've got to, and you've got to talk about the evidence for these individual choices. And then eventually they'll make the choice, and we mustn't get upset if the choice isn't what you think they should do. And moving on, harmony beyond pills and procedures, and membership of a society, and burnout equalities. And perhaps burnout equalities is such a negative thing. I mean, we have seen such inequality happen through this COVID, and it's horrendous. And we're going to see more inequalities, and perhaps we should not burn out inequalities. We should just strive for equality in a much more positive way. And there have been huge inequalities, and it's going to get worse. And look at this, the homelessness, that someone is homeless, much greater problem with employment, huge mental issues, long-term physical health, and use of drugs. And if you haven't read it, it's a wonderful book. She just published the second book called The Salt Path by Raina Wynn, who was homeless, and she and her husband walked the southwest coast over 2 years. And it's quite inspirational in their 50s how they did it with literally no money, and it's well worth a read. So what I'm saying is, you've got the individual and the individual lifestyles, and then you've got to look at their role of community and the role of work and how it involves the whole of one's life. And it's not working in individual silos. We've got to all work in harmony with each other. And that is what, and I'm a great supporter of social prescribing, which is happening more and more and within society, within GP practice. And it's sometimes referred as community referral. And it enables the GPs and nurses to offer, through link workers, a range of non-clinical services, such as walking, such as gardening, such as going for swimming, etc. And social prescribing and making people feel part of the community is medicine without pills. And this is so good for mental health and for physical health and for the role of the community. And through that, and a little plug, and I encourage all listeners to join the College of Medicine, which I'm treasurer, which is trying to push this forward. It's to move the center of gravity back to the patient. We've forgotten that. We've got to look at education, and we mustn't go against the grain of nature. And in some way, when you look historically, we're about pandemics. Pandemics were caused by us trying to be unnatural, to have urbanization, to live without the role of the environment. And it's probably a reflection of bad living that has caused a lot of the problems. And when we were hunters-gatherers, we didn't have these problems. And we've got to look at the role of self-healing, food, the forgotten medicine, exercise, the forgotten medicine, and sleep, the forgotten medicine. And I think also we've got to question, operations have a huge role, but are we sometimes just rushing to do operations because that's the easy option? And should we question how many operations are we doing? And are they all necessary? And can one look at alternatives rather than operating for unnecessary purposes? And I know in my area of gynecology, there's several operations that may not be needed to be done as often as they are. So we're moving on and nearly the end now, that we've got to look at looking outside the box, and we've got to look at an integrated approach, but we're all a team. And I think this is so true. Eddie Jones, the manager of the English rugby team, said, and it's definitely happened in this time, is a team is like a tea bag. You don't know how good it is until you put it in hot water. And that's so true, that the teams are so important. We've got to work together, and it's not them and us. And we as doctors have got to work with the whole team in a harmonic way, with the architects, with the nutritionists, with the exercise physiologists, in order to make the better life for people. And finally, we're looking on to the role of nature, and how nature has such an important role for our health. And being a gynecologist and obstetrician, we talk about the environment, but the most important environment, which in my opinion can affect the life of not only the individual, but also the community, is the environment of the mother's womb. And we do know that looking at the role of environment and genetics and epigenetics, the role of the environment of the mother's womb can have a huge, huge impact on all of our health. And we've got to address that. And this is well demonstrated now, that the first 9 months shape the rest of your life. And that's the 9 months in your mother's womb, effect on cancer, heart disease, obesity, depression. And so the science of fetal origins goes back to the whole experience of the womb. And I think a most terrifying story is how it all links up now, between my thought about food, the environment, and not only the food that we eat, but the food that your food eats. This is a terrifying study about night soil. And night soil is well recognized, and it's the role of human manure. And human manure has been used to fertilize land. But a colleague of mine has looked at the role of the human manure being fed to sheep, and sheep then breeding, and the effect of that on the fertility of the future generations. And in some way, what we're seeing in future generations of fertility is that the sperm in some way is being the canary. Remember, in the old days, the canary would go down the mines, and the canary, by going down the mines, would stop treating or die when there was toxins. So what would happen here? What's happened here is, so these sheep, and he's done it with dogs as well, pregnant ewes are fed on manure, or a beautiful pasture that has been manured by human manure, which had the toxins in it, and their sperm count has gone down. And the fertility of the lambs, whether they're male or female, the ewes or the rams, has gone down significantly, because the environmental toxins have gone into the food that the sheep are eating, that then gone into the next generation. So we've got to look at the food that our food eats, and the environment of the womb, as Amartya Sen said, has a huge effect on the health and productivity of the population. And using and understanding the environment of the womb may help hugely in generations to come. And there's several ways we can do that. We can look at education, good diet, folic acid, vitamin B12, avoiding smoking, excessive exercise, being careful of that, but good amount of exercise as well. Look at the role of stress and good antenatal care. And also, finally, the role of sleep. Again, another good book, if you haven't read it, Why Do We Sleep? And the conclusion is that sleep is so good for you that if you don't sleep enough, it increases the risk of diabetes, Alzheimer's, heart disease, stroke, heart failure, depression, anxiety. And it went on and said that we're asking the wrong question, not why should we sleep or why are we sleeping? The question we should be asking is, why are we awake? Waking does the damage, sleeping does the healing. Such simple things which go back to Gandhi and all the people I mentioned in the talk. And there's lots of evidence that exercise and attention restoration therapy, that mental fatigue and concentration can be improved by time spent in the environment. And I love this idea, is walking in the park, etc., is inoculation. You inoculate against, you use vaccine for smallpox and polio, etc. Should we be inoculating against emotional upsets and stress by just encouraging people to do more and more exercise? So that's the idea that I have about harmony and health, that we've got to look at the role of us all working together, the role of the environment, the role of history, the role of resilience, etc., in order to give patients the options, and then it's you give them the options and it's their choice that they make to help them move forward. And we finally must remember that our role as health professionals is do unto others as you would have them do unto you. And first of all, do no harm. So thank you very much for having me. I just want to just give you some ideas about, I think, as all working together with harmony, looking at the role of history and exercise and nutrition and the environment can have such a significant impact on the health of the individual, the health of the community, and we've got some involvement in the community, and be good for us all. And thank you to John Baines for supporting this conference. Thank you.